10 clear signs pointing to fatty liver disease. Fatty liver disease, once considered a rare condition, has now become a global health concern affecting millions worldwide. With its insidious onset and often asymptomatic nature, diagnosing fatty liver disease can be challenging. However, there are subtle clues that the liver gives away, hinting at its compromised state. In this comprehensive guide, we unravel the 10 telltale signs that may indicate the presence of fatty liver disease. Building upon the metabolic ramifications outlined in the introduction, let's explore how this impacts daily life. Fatigue and malaise. The liver stands as the cornerstone of our body's intricate metabolic processes, orchestrating the symphony of energy metabolism essential for our vitality. Yet, when laden with surplus fat, its once efficient mechanisms falter, plunging us into a realm of perpetual weariness and overall discomfort. Tasks that once felt effortless now become arduous trials, as fatigue permeates our being, casting a shadow over our daily endeavors. The burden of excess fat disrupts the liver's harmonious dance of energy regulation, leaving us grappling with a pervasive sense of malaise that clouds our every movement. We find ourselves navigating through the day with leaden limbs and a foggy mind, battling against an invisible force that saps our vigor and vitality. As the liver struggles under the weight of accumulated fat, its ability to sustain us wanes, leaving us adrift in a sea of exhaustion and inertia. Each step becomes a laborious journey, each task an uphill climb, as the relentless fatigue gnaws at our resolve and dims the spark of our vitality. Yet, amidst the shadows of weariness, there remains a glimmer of hope, a beacon guiding us towards reclaiming our energy and vitality. By understanding the profound impact of excess fat on liver function, we pave the path towards renewal and rejuvenation. Let us embark on this journey together, shedding the burdens that weigh us down and embracing a life filled with vigor, vitality, and boundless energy. Transitioning from the general sense of lethargy, individuals with fatty liver disease often encounter another distressing symptom: abdominal discomfort. Abdominal discomfort. With the advancement of fatty liver disease, abdominal discomfort emerges as a prevalent symptom, casting a shadow over the affected individual's daily lives. Many patients describe experiencing a persistent dull ache or a sensation of fullness specifically in the upper right quadrant of the abdomen, precisely where the liver resides. This discomfort, akin to a silent yet insistent plea for relief, serves as a poignant reminder of the liver's compromised state. Moreover, it often intensifies following the consumption of fatty or fried foods, echoing the liver's struggle to navigate through the deluge of dietary fats inundating the system. Imagine a constant tug of war within your abdomen, an unrelenting discomfort that refuses to subside, even as you strive to find respite. Each meal becomes a precarious balancing act, fraught with the fear of aggravating the already inflamed liver. The mere thought of indulging in savory delights sends shivers down your spine, as you grapple with the repercussions of every morsel consumed. This abdominal discomfort transcends physical sensations. It permeates the very fabric of your existence, casting a pall over moments of joy and serenity. Simple pleasures such as savoring a meal with loved ones or engaging in leisurely activities are overshadowed by the looming specter of discomfort. Yet, amidst the throes of agony, there lies a glimmer of hope, a beacon guiding you towards reclaiming control over your health and well-being. By heeding the subtle yet unmistakable cues of abdominal discomfort, we embark on a journey towards healing and restoration. Let us embrace this opportunity to forge a path towards renewed vitality and freedom from the shackles of fatty liver disease. As we explore the metabolic disturbances underlying fatty liver disease, it becomes evident how they contribute to this gradual increase in body weight. Unexplained weight gain. Unexplained weight gain, especially concentrated around the abdominal region, often serves as an ominous precursor to the onset of fatty liver disease. This accumulation of visceral fat, intertwined with the insidious presence of insulin resistance, sets the stage for a cascade of metabolic disruptions that pave the way for this debilitating condition. Despite diligent efforts to adhere to a nutritious diet and regular exercise regimen, the scale stubbornly inches upward, sounding the alarm for underlying metabolic turmoil. It's akin to navigating through a labyrinth, where every step forward seems to be met with an inexplicable setback. Despite your unwavering commitment to making healthier lifestyle choices, the relentless expansion of your waistline leaves you feeling disheartened and defeated. Each passing day brings with it a mounting sense of frustration as you grapple with the enigma of unexplained weight gain. Yet, amidst the shadows of uncertainty, there exists a glimmer of hope, a beacon guiding you towards understanding and overcoming the underlying metabolic aberrations. By unraveling the intricate interplay between visceral fat accumulation, insulin resistance, and fatty liver disease, we pave the path towards reclaiming control over our metabolic destiny. Let us seize this opportunity to embark on a transformative journey towards holistic well-being and vitality. The metabolic aberrations associated with fatty liver disease are reflected in routine blood tests, which often reveal elevated liver enzymes. Elevated liver enzymes. Routine blood tests frequently unveil heightened levels of liver enzymes, notably alanine transaminase, ALT, and aspartate transaminase, AST, in those afflicted with fatty liver disease. These enzymes spill into the bloodstream as liver cells undergo damage or inflammation, acting as pivotal indicators of hepatic impairment. Vigilant surveillance of liver enzyme concentration stands as a cornerstone in the timely identification and control of fatty liver disease. By tracking these markers, healthcare providers can swiftly intervene, implementing tailored strategies to mitigate progression and avert potential complications. Consequently, routine monitoring not only aids in the early detection of hepatic dysfunction but also facilitates proactive management, enhancing overall patient outcomes. This proactive approach underscores the significance of regular blood tests in safeguarding liver health and underscores the importance of proactive healthcare measures in combating liver diseases. As the disease progresses, biochemical abnormalities may manifest as overt clinical signs, such as jaundice. As fatty liver disease progresses to its advanced stages, jaundice can emerge due to the buildup of bilirubin, a yellow pigment typically processed and excreted by the liver, within the bloodstream. This condition manifests visibly, with patients experiencing a noticeable yellowing of the skin and the whites of the eyes, sclerae, accompanied by alterations in urine coloration towards a darker hue and stool becoming notably paler. Jaundice serves as a critical indicator of substantial liver dysfunction, signaling the urgent need for medical intervention. Its appearance underscores the severity of liver impairment and the potential for complications if left untreated. Prompt medical attention is crucial to assess the underlying causes, manage symptoms, and implement interventions aimed at preserving liver function and overall health. Thus, recognizing and addressing jaundice promptly is paramount in mitigating the progression and impact of fatty liver disease. Transitioning from cutaneous manifestations to anthropometric measures, let's investigate the link between increased abdominal girth and fatty liver disease. Increased abdominal girth. Fatty liver disease shares a tight bond with metabolic syndrome, a complex of health issues encompassing abdominal obesity, high blood pressure, and abnormal lipid levels. As excess fat accumulates around the abdomen, individuals often witness a gradual expansion of their waistlines, commonly termed central or abdominal obesity. This outward physical change isn't just a matter of aesthetics. Rather, it serves as a tangible signal of deeper metabolic imbalances lurking within. The expanding girth around the midsection mirrors the underlying disturbances in metabolic processes, reflecting the intricate interplay between fat deposition and metabolic dysregulation. Recognizing this visible marker prompts a deeper understanding of the systemic implications of fatty liver disease and its association with broader metabolic disturbances. By addressing the underlying metabolic issues driving abdominal obesity, healthcare providers can take proactive steps towards managing and mitigating the progression of fatty liver disease, thus promoting overall health and well-being. As we unravel the metabolic intricacies of fatty liver disease, insulin resistance emerges as a pivotal player in disease pathogenesis. Insulin resistance. Insulin resistance, a defining feature of type 2 diabetes mellitus, often accompanies fatty liver disease, forming a complex interplay that exacerbates metabolic dysfunction. Within this intricate web of metabolic disturbances, the liver's pivotal role in glucose regulation becomes profoundly affected. Insulin resistance disrupts the finely tuned equilibrium of glucose metabolism, resulting in elevated blood sugar levels, hyperglycemia, and compensatory increases in insulin secretion, hyperinsulinemia. Consequently, individuals grappling with both conditions may encounter a constellation of symptoms synonymous with poorly managed diabetes, including insatiable thirst, frequent urination, and blurred vision. This convergence of insulin resistance and fatty liver disease underscores the multifaceted nature of metabolic disorders, necessitating a comprehensive approach to management. Addressing both insulin resistance and fatty liver disease concurrently is crucial not only for symptom alleviation but also for mitigating long-term complications and improving overall metabolic health. Beyond metabolic disturbances, fatty liver disease manifests in a myriad of cutaneous clues, including spider angiomas. Spider angiomas. Spider angiomas, also known as spider nevi, are superficial dilated blood vessels commonly observed in individuals with liver disease. These vascular lesions typically present as small, red arterioles radiating from a central point and blanching upon pressure. Although benign, spider angiomas serve as a cutaneous clue to underlying hepatic pathology, prompting further evaluation. Transitioning from benign cutaneous lesions to life-threatening complications, let's examine the pathophysiology and clinical implications of ascites in fatty liver disease. Ascites. As fatty liver disease progresses to cirrhosis, complications such as ascites may ensue. Ascites refers to the accumulation of fluid within the peritoneal cavity, leading to abdominal distension and discomfort. Impaired liver function disrupts the synthesis of albumin and other proteins involved in fluid homeostasis, exacerbating fluid retention and necessitating therapeutic intervention. From abdominal distress to neurological dysfunction, hepatic encephalopathy underscores the multisystemic impact of fatty liver disease. Hepatic encephalopathy. In advanced stages of fatty liver disease, hepatic encephalopathy may develop as a result of impaired detoxification and ammonia clearance by the liver. Patients exhibit cognitive dysfunction ranging from mild confusion to profound coma, along with characteristic neurological symptoms such as asterixis and fetor hepaticus. Prompt recognition and management are essential to prevent life-threatening complications. Fatty liver disease poses a significant public health challenge, with its prevalence reaching epidemic proportions worldwide. While often asymptomatic in its early stages, the liver subtly communicates its distress through a myriad of signs and symptoms. From fatigue and abdominal discomfort to jaundice and hepatic encephalopathy, recognizing these telltale clues is paramount for timely diagnosis and intervention. By raising awareness and promoting early detection, we can stem the tide of fatty liver disease and safeguard the liver health of generations to come. Join our community dedicated to liver health. Like, comment, and subscribe to our YouTube channel for more expert insights, tips, and resources on managing and preventing fatty liver disease. Together, let's take proactive steps towards better liver health and overall well-being. Don't miss out. Subscribe today.